not at all whatsoever. I ain't got time for that. I'm a professional. Welcome to Daycare Chronicles 101, and I am your host, Miss Tanya. Okay, ladies, I just want to say good afternoon to all of you. I am so excited to have you here for the Daycare Chronicles. You know, I am an essential business Zoom. Let me say this. We are essential workers, and we should be proud of ourselves. We are caring for the children of essential workers right now. We are mothers. You know, we're the chef, we're the cook, we're the doctor, we're all of that right now. And so I just want to thank you all for being on the Zoom today. And I'm just going to jump right on into this. We're going to start with the PowerPoint presentation. And so the first thing here is being an essential business during this pandemic. How essential is daycare? Well, CNN.com did an article, and you can go and look it up for yourself. The economy cannot recover until parents have childcare again. Childcare is a necessity. Without childcare, nothing happens. Parents have to be able to go to work. Parents want to know that their children are safe. And I'm sure that you all agree with me, being that we're providers that are on the Zoom right now. Daycare is very, very essential. The thing that we're dealing with now is the fact that we're considered to be essential workers, but we're not being treated that way. Do you feel essential? For those providers that are still open and serving essential workers, do you feel like your clients really understand and appreciate you being open during this pandemic? Can I get some of you all to chime in on that part right there? Because I feel like my clients don't really understand what's really happening here. I feel like they just don't get it. And I've tried to explain that to them. You know, they come, they drop the children off. It's like no big deal, you know, about, oh, well, you're still open. Even though we have new procedures put in place, we're taking temperatures every day. We're giving them hand sanitizer, washing their hands when they come in, not allowing the parents to come in no further than, say, the front doorway. So even though all of this is going on, I still feel like some of the parents just don't get it. How do you all feel about this? Forced to close due to stay-home order in Pennsylvania. Some parents don't understand and try to help while others don't. Absolutely. You're so right. Some of my parents think this pandemic is a joke and they do not take any of the restrictions seriously. Right. Absolutely. Do you feel like the state resource and referral agencies could be doing more to provide essential supplies for daycare providers? I know I do. We've been at this since March. We just now received a survey from our R&R, Crystal Stairs, asking us how many children we have, if they could provide supplies for us, or if they could give us money, or either they would do the supplies, or if you just want to get the cash. They prefer that you do the cash. So this is what, 3 months in? 3 months in. Of course, we're appreciative because we have been running around with our heads, you know, just crazy, trying to find essential supplies. Essential supplies, I mean, it's just like, that's our PPE, you know? We don't have Clorox, if we don't have bleach, if we don't have gloves, if we don't have masks, if we don't have hand sanitizer. And this is just regular, you know? This is what we do on a daily basis as providers. Can I have some of you chime in on this? Do you feel like the state resource and referral agencies could be doing more to provide essential supplies for daycare providers? Let me hear from you all. I have parents that want to bring their kids when they're home. Yeah, the state of California only allows you to care for children that have parents that are essential workers. If you're not an essential worker, then right now in the state of California, you cannot bring your children. Limited gloves and supplies. Yes, gloves and supplies. I mean, absolutely. We have to have these things on a daily basis, no matter what. We have to have them. Cameron, what county are you in? Hi, Trina. State assistance is limited. The expectation is that providers will get supplies on their own. And not only is that an expectation, that's a fact, because that's what we have been doing, getting our own supplies. My husband has been running around like he is the Book of Eli, and he will tell you that, trying to get all of the supplies that I need to make sure that we are safe in our home, that the children are safe, you know, in the home. We're trying our best to prevent COVID-19 from coming into the daycare. And every day is a risk for us as providers because we don't know where these parents have been. We don't know where the children have been, when they leave our care. Do you advise for in-home providers to have an air purifier? Yes, that's absolutely a good thing. That's a really good thing. I actually had ordered a UV sanitizer and I ordered it. Unfortunately, I guess Amazon got too many orders and I didn't receive it. They gave me my money back. So I'm still looking for another UV sanitizer, which is a really, really good thing to have as well in the daycare. Things have changed. The game has changed, you guys. It has definitely changed. So now we're going to move on to the next slide here. Do you have the essential supplies needed? How are you acquiring these essential supplies that are needed, being that we're out here on our own? Can you just chime in the chat box and let me know, how are you acquiring the essential supplies needed? What essential supplies are you in need of? And in the event that you're not able to get what's needed, there are other options that are out there. And we just got to go old school. There's borax. You can buy that at Target, at the grocery store. You mix it with water and you have something to clean with. There's soap flakes, there's baking soda, there's vinegar. These are some options for cleaning as well when you can't get what's needed.
So here I'm not open, but a lot of the parents are staying at home. Some parents have been paying me. Other parents are upset of the fact that I'm asking to pay to keep their spots. They don't want to pay nothing for supplies. I've just been using my money that I've been getting.
Yes.
My own money to buy supplies, trying to get whatever I can because the stores, they're limited. And sometimes they're even expensive online. You're paying double, triple the price sometimes to get things.
Absolutely. No, absolutely. Where are you located, Amparo?
I'm in Los Angeles.
Okay. Yes. Well, definitely send me a DM and I can get some help for you. Okay.
Okay.
Definitely. Because I'm in Hawthorne. We could definitely do that. And I thank you so much for sharing. Thank you so much.
So I'm in Chicago and I'm a director. Yes. And we are not open, but right now we're trying to do surveys to see if we open June 1st because they just put an executive order in Illinois to change the definition of essential workers.
Really?
Which I don't understand at all.
Okay.
However, so we're doing the survey to see who now qualifies as an essential worker. And then if we have enough children, then we'll open. We're not going to have like 3 kids because, if it turns out it's 3 kids in 3 different classrooms, then I have to be on site regardless, being the director.
Okay.
Then I would need 3 teachers. We wouldn't be eligible for catered food. It would be a logistical mess for me. So right now, what I'm personally doing is rewriting policies and addendums and procedures and protocols.
Right.
And in addition, the owners are trying to make sure we have supplies. So since we closed in the middle of March, we still had the rest of our March supplies.
Okay.
But it's been so hard. So I am old school. My grandmother raised me. So I'm like, okay, look, you need to get some peroxide. We need some vinegar. I'm like,
right. That's right.
I'm like, we're just going to have to think out of the box about this. And, I'm just going to have to be in charge of making the solutions to make things stretch or, where I know they're used effectively and appropriately. Even trying to use some essential oils like tea tree oil.
Yes, ma'am.
It has it's like bleach alternative or something because I need something in the classroom that's safe for the kids. I can't be spraying bleach solution while the kids are in the classroom because that's not safe for them. So just really trying to think out of the box and get whatever we can before we open so that when we open, we're at least okay until, like the resources come. We are also private pay, so we don't get a lot at all.
Yes, ma'am.
So, there's really not a lot of talk about how private paid people are surviving during this.
Right. Well, thank you so much, LaDoris. Thank you for sharing that with us. Thank you. And I just pray that you're able to get the essential supplies that are needed and that you all will be able to open soon and still stay safe, even in the event of being able to open.
Yes.
Thank you so much. Appreciate you. We're going to take one more. Hi, Stacy. How are you?
I'm good. How are you?
Good. So you were saying that you stocked up on some supplies. Can you just talk about that?
I also do taxes during tax season because that's what my family's business is. So I help out on the weekends. So every January, I always stock up because I have no weekends.
I got you.
So
Yes,
I thankfully stocked up way back in January, but I mean, we're in May, so
Right.
those are dwindling.
Absolutely.
So
Absolutely.
I haven't
Yes.
had to worry. Yeah, I haven't had to worry about Lysol, cleaning supply, that kind of stuff just yet, but I'm going to eventually be getting there. So right now, if my family sees anything, they grab an extra thing of gloves. So far, the only thing I really haven't been able to find again is Lysol and like Clorox wipes, that kind of stuff. So
Yeah, that seems to be the main things that we're lacking. I actually called the 800 number on the back of the Lysol can the other day.
mm-hmm.
And I'm like, what is going on? Are you still making Lysol? Like, what is happening?
Awesome.
Here? We cannot find Lysol anywhere. And the answer to my question was, yes, we're still making it. Yes, we understand that, there's a need for it, and you'll just have to find it in a store.
I went on to Amazon because we just got a 6-page compliance thingy for COVID from licensing.
Yes.
And they were wall-mounted hand sanitizer. So I went online to find them. I have pump ones, but I went online to find the touchless ones. And Amazon's selling them to anyone that's not a government worker or a hospital.
Absolutely. Well, I know. I thank you so much for sharing, Stacy. We all feel each other's pain. Thank you so much, Stacy. We're going to move on to the next slide in the PowerPoint. What changes have you made in your facility due to COVID-19? Have you set up a screening station? Are you doing your temperature checks, your hand sanitizer for entering the daycare? What are you doing about sick children? We don't know who has been exposed or a carrier of COVID-19. What adjustments have you made to what the children have access to now? Have you changed group play? Have you taken the soft things out? Licensing tells us now to take all the soft toys out, no stuffed animals and things like that. What are your methods of sanitizing and disinfecting? Please go to the chat, look at this, go to the chat and please chime in. I know that I have set up a screening station when you walk into the daycare. So I'm doing temperature checks on my staff, the employees, the parents. I just had them sent at the door. They can't even come in at this point. If a child shows any signs of sickness, I call the parent, if they have a fever. This is just regular stuff that we do anyway as providers. This is what we do. We're sanitizing more, of course. However, it's just getting what we need. So let me hear from you all. What changes have you made to your facility due to COVID-19? Ladoris says, too many. Screening station, log in, parents get to, everything, mask. Yes, the stuffed animals are gone. Exactly. And you clean with natural homemade mixture and sanitize. Do not sleep on vinegar. Vinegar is really good, and I understand that you don't want to clean with bleach, but if bleach is all that you can find, do that in the evening when the children are gone, dilute it a little bit. You have to do something. We have to kill the virus. We have to make sure that the virus does not live on our surfaces. Vinegar, yes. What adjustments have you made to what the children have access to now in your facilities? Can someone chime in on that? Limited toys seems the biggest thing. Yes. Lots of outside playtime. Stacy, will you please unmute yourself? Yeah. Lots of outside playtime. I have an indoor-outdoor classroom. We're outside every day that we can be. Absolutely. Hi, Terry.
Hey, I'm sorry. I can't put my picture on there, but I'm driving, but I'm listening.
Okay, good. Thank you so much. So
let me just say what I've been doing with my kids. We've been staying outside a lot.
Okay.
And, that's the way that I'm trying to take care of things. Then that way we don't have to bring out too much stuff inside of the daycare.
Yes. Very good. Very good.
I don't let the parents inside the house at all.
Yeah, I think we're all going to that. Like, we don't know what's on the bottom of your shoes, where you've been, who you've been around. Absolutely. Thank you so much for sharing, Terry. Trina.
Okay. Well, it's 2 Trina Richardsons.
Mm-hmm.
Well, it's actually like 4 or 5 of us.
Yes, ma'am. So what are you doing at your facility?
Well, right now we are closed because our county is in the red zone in Pennsylvania.
Okay.
So we're actually closed. When the pandemic first started, we did open for essential workers, but it was discovered that our parents weren't so essential. Some were not working, and some were not working essential jobs, or they were staying home.
Wow.
So the staff was very uneasy about remaining open and taking that chance.
Okay.
And eventually the stay-at-home order was spread through our county. So we decided to go ahead and close.
Yes, ma'am. Better safe than sorry.
Mm-hmm. We're looking to reopen. They're going through 3 phases in Pennsylvania: the red phase, the yellow phase, and the green phase.
Mm-hmm.
Right now, our county is in the red phase, and they're looking to move to the yellow phase June 4th.
Okay.
So we've been keeping in touch with our parents and kind of getting a feel for what they will need regarding childcare. Mm-hmm. A lot of them haven't been working, so I'm expecting that our enrollment is going to drop. So until, we're just taking one day at a time.
Yes, ma'am.
I know that our licensing department has been heavily persuading providers to just go with what the CDC says to do.
Yes, ma'am.
So they've been referring us to the CDC.
Okay. Well, thank you so much for sharing.
Thank you
so much.
Thank
you so much. So we're going to go on to the next slide. How is virtual distance learning affecting your facility? Is there a quiet place that you have for the children that have to do their Zoom lessons? Do you have them bring headphones? Are you supplying any of the devices for the children that are there? And then most importantly, how are the children handling this? What is their mental state? I want to hear from you all. Virtual distance learning, a new way in life. Sheena says she's in Washington, D.C., and Target, Giant, Walgreens has hand sanitizer. So try those in your area. Thank you, Sheena. Amparo says she's thinking of cleaning shoes when they come in. As I am, there is a thing on Amazon where you put your foot in it and then it covers your booty. The booty covers your shoe. I'm thinking of getting that as well. Ladoris, of course.
Distance learning. So my school is 6 weeks to 3 years old.
Okay.
And it is no joke to try and get these little bitty people to now see me through Zoom when they're used to me hugging them.
Yes.
And have had been hugging them since they were 6 weeks old. So it is a challenge. But surprisingly, a lot of them are okay. Like their attention spans, of course, are
right.
But they have really been sustaining with their engagement. But I think for us in particular is because we've been very diligent. Like my staff and I, we Zoom with them 3 days out of the week, 2 times a day. So before nap and then after nap, we do activities with them. And then on Tuesdays and Thursdays, we post lessons. So we do videos and activities that way. So they still see us, but it is very obvious that they miss like the physical part of us. So, I mean, we don't know what we're doing. I tell the kids that all the time. I'm like, Miss Ladoris she's learning with you guys, trying to figure out how to do this. So I think they understand. They give me grace. That's for sure. But it is definitely a challenge. I did write a little guideline for the families, like to kind of encourage them to, have them sitting at a table or, they're not going to do it if they're running around because they're used to me chasing them.
Right. Yes, ma'am.
So
thank you so much for sharing that. I want to have, if my sister will, Ayana, if you could chime in on how the distance learning is affecting my nephew, if you could.
Sure.
Thank you.
So I'm a mom of 2 boys, and one is 7 years old and one is 4 years old. My 7-year-old is in Catholic school. And on that Friday in San Diego, which was March 13th, Friday the 13th, school shut on that Monday with virtual distance learning. And it has been extremely challenging as a mom that's still working and one that is not a teacher. to deal and manage with the amount of work that was coming in from the school. Also, it's difficult with the children not being in a school environment to take what we were doing seriously and understand that we're doing curriculum in the house and not homework all day. A lot of tears and sadness, mostly from me, but also from my son about having to do all of this work all day long and getting them to understand that the education really has to go on despite the fact that they're not at school, and also bringing down our expectations as parents, because now we're getting used to having to be the teacher and having to really hone in on your patience with your child. Because by trade, I am not a teacher. I'm a physician, and I have not taught and sat down with a child that's in the first grade, and I was in the first grade. So this has been extremely challenging in our home, but we're incredibly grateful that we actually have a curriculum to follow.
Thank you so much for that. I'm sure so many parents and providers are feeling the same way. Thank you so much for sharing that. Can I get someone to chime in on how the children are handling this? How are the children handling this as well?
Sure. So I run a daycare too, and my kids are at home as everybody else. And my problem is that my own kids sometimes have it hard doing lessons just because the daycare is a distraction to them. And most times they want to be with the daycare kids and they want to be here downstairs in the daycare. And I have found myself neglecting my own kids. And what I have found is that my son did not do some of his homework. And then this week I got a letter from my daughter's teacher saying that she was missing 14 out of, 14 lessons. And Miss Tanya, honestly, she's doing her work, but something is not happening where she wasn't submitting the work that she did.
Right. Yes.
And two, she was not doing the maths that she was supposed to be doing. So, it's really hard as daycare providers. It's extremely hard for us to juggle all the hats that we have, especially when we have kids of our own, to do the schooling with them, to run the daycare, to think about cleaning, to think about cooking, and for me, I lost my assistant because I don't have the amount of kids because we're still working with a limited number of kids. So it's just hard.
It is hard. I actually have a school-age child that's here, and she would get on her Zoom. She would put her headphones on, and I'm thinking that she's doing everything. I tell parents I am not the homework police. That is not who I am. And so I thought she was doing everything she needed to do. She would get off her Zoom and, we would go on with the day. She wasn't finishing her assignments. She wasn't letting the teacher see her. She was sitting there pretending. So her mom had to talk with her. Things are better now, but it's the same thing. Like, she wasn't turning in anything. It was just very, very difficult. And I was providing everything that she needed, the quiet space, the headphones, everything. But, it definitely is a change and a challenge. Definitely. Yeah. And I noticed that, they get a little sad because they're at daycare all day. Some of them, of course, they want to be in school. So this is something that I posed to the children. I said, what would you like for Miss Tanya to have in my daycare so that you will feel comfortable and be happy while you're here? Because we all have to get through this COVID-19 together. So that's something that y'all may want to think about, is asking the children, how do they feel about this? What would they like for you to have? I always say that once a child gets bored, here comes the problems. So this is a more sensitive situation as well. They're not at home. They're not at school. They're at daycare all day with the little ones, So definitely their feelings matter. And we need to let them know that their feelings matter. We do.
Thank you, Ms. Tanya.
Yes, thank you for sharing. We're going to go to the next slide, which is a little additional information. For those of us that are in California, we have the community care licensing. For those that are in other states, please go to the site that has licensed you and check for updates. Here in California, we can go to the community care licensing, and there is a PIN 20-06. Please go read it, print it out. There's some new regulations that are in there that we need to be following. Also, I listed a few little resources of places that my husband has gone out for me Mr. Booker Eli, to get supplies for me that I am so grateful for. So here are a list of places here: the Restaurant Depot, Sky Dental, which is a dental company, and I had to get sanitizing wipes and Lysol from them. There's another place, Daldul, they had gallons of things. So check them out. They're in the City of Commerce. And then our local garden nursery had aloe vera gel. I was like, I can make my own hand sanitizer. I found the alcohol, but I couldn't find the aloe vera gel. So now, you can get sanitizer in the stores, but in the event that, we can't again soon, then you can make your own. So this is just a little additional information. Take a picture of it, screenshot it, whatever, so that you have it. But we definitely want to be in compliance with licensing and how we're doing things in our facilities. So take a chance and just go over PIN 2006 and just check that out. At this time, we're going to talk about self-care. What are you doing for self-care? I know it's hard because we have become the nail tech, the brow tech, the hairstylist. We doing manis and pedis, and it is what it is. On top of being providers, on top of being a wife, on top of being a mother, grandmother, it's just a whole lot right now. We wear enough hats. We're the baker, we're the chef, we're all these things, and we're the teacher. So what are you doing for self-care? You must take time for yourself. Exercising, yoga, walking, meditating, even if it's 2 minutes, you got to do something for yourself. If you get to the point to where you're feeling overwhelmed, it's okay to take a break. You can walk away for a minute, take a deep breath, and just gather yourself again. We have to eat. We have to eat balanced, nutritious meals. Don't put all the junk up in your body. Eat some good stuff. And then also, this is something I deal with. Some things, they can wait until later. Patience is a virtue. If LaShana is on the line, I would love to have LaShana speak a little bit about self-care. And also, I would like for you all to type in the chat, what are you doing for self-care? Is LaShana on the line?
I'm here. Can you hear me?
I can, beautiful.
Hey, how are you?
I'm good. Please help us.
Everyone. Hi, everyone. My name is LaShana, and I'm just here. Sonia asked me to come to just talk to you guys a little bit about self-care. I know everybody is struggling with that. It's like we're all overwhelmed. We're all in our adaptive personalities right now. We're trying to make it happen. And regardless of wherever you are, whatever state you're in, whatever part of the country you're in, we're all feeling it. We're all feeling it. And so the first thing I want you to do is just give yourself some grace, take a deep breath, and just recognize that things are different. You have to know that things have changed and they're not going to go back to the way that they were. And so it's a process of acceptance that you have to go through. That, okay, we got to realign, we got to, make some things happen, we got, do things a different way, but give yourself some grace, especially if you're balancing your home life and your work life, understanding that, your home has to be the most important place, the most peaceful place for you. So the people in your home, you got to give them some grace too.
Yes.
So even though you guys are daycare providers and, but you're moms to your children and not teachers, so give yourself permission to just be a mom to your children and not their teacher. We have all of these different things going on with schools and, and to be honest, schools don't know what they're doing either.
Right. I agree.
So they're learning. There's a lot of things going on. They've already done attendance for the year. So everyone's accounted for. No one is failing. No one's child is failing. So with that off your plate and without that pressure, your kids are going to be fine. It's a couple of months, of them second semester, and they're going to be fine. Our leadership as parents, that we are taking care of ourselves so that our kids feel like it's okay too. But if we're anxious and if we're, panicking and we don't know what's happening, we're getting overwhelmed, that's how they're going to feel too. So before you can even start with self-care, the first thing you have to do is just practice gratitude first thing in the morning.
Yes.
Anything. Because what happens is sometimes when you're feeling really anxious and you're not sleeping that good at night and you're trying to make yourself happy, it's like you're talking yourself into being happy, like, gonna have a good day. You know, you're doing affirmations. But the truth is your body won't even allow you to process it because you're really worried. So the worrying won't even allow you to process the good feelings and the affirmations. So your body chemistry, you practice gratitude. If you have to write a list of things that you're grateful for and meditate over that list, pray over that list about things, about being grateful for waking up. People are dying. People are dying. A lot of people are dying, you know, Absolutely. And so you have to be grateful for that God woke you up, regardless if you have your supplies, regardless if 2 kids are in the classroom or 20, you woke up. So you have an agenda for the day. God, he blessed you to wake up. So just being grateful for your life, your children, your family, the food that you have, whatever you have, you know, there's so many things that we can be grateful for, that just thinking about today and taking it one day at a time. So the best self-care practice before exercising, before eating anything, you know, really work on your gratitude. Because we can get so caught up with what we don't have and what's going on, and, you know, the president not making the right decisions for us, remembering that God is in control. He is here for us. We're on the Zoom call. So we got Wi-Fi, we got internet, we got phones.
That's right. Oh, LaShana, thank you so much. Thank you so much for coming on. Gratitude. I really, really love that. You hear that, ladies? Gratitude.
First area of self-care to work on.
Thank you so much, LaShana.
You're welcome.
I'll be doing a podcast with her soon, ladies. So look forward to more.
Back. We'll go into more stuff like lip gloss and
all that
there on YouTube and all that. But just gratitude for now. Gratitude.
Yes. Thank you so much.
You're welcome. Have a great afternoon, guys.
Thank you. We're going to go to the next slide, which is about my book and my YouTube channel and my podcast. If you don't have Daycare Chronicles 101, then go on Amazon and purchase it. It's at a discounted price right now, $10. I don't know how long it's going to be like that, but go on Amazon, support your sister. You know, I have enjoyed this so much. Before we end, though, I have something that has just come out in the news that I want my sister, Dr. Ayana Boyd-King, to speak on. My sister is a critical care pulmonologist. She's a triple board certified physician. And so I've asked her to come on and talk about Kawasaki disease, if that's the correct name. Because we're thinking that children can't get COVID, but they're getting something that is, quote, like COVID. But I'm going to let the expert speak on this. Ayana?
Hi, thank you all. I just want to say, first and foremost, I'm a mom before all of those things that my sister mentioned. And like you, being an essential worker is something that's extremely challenging and difficult in this time that we're living in. And I have a great appreciation for what you all do. I am a pulmonary critical care doctor here in San Diego, and I'm a frontline physician. And every day, since this has started, has changed my life as well. We're all learning. Everything is in constant evolution because there's so much that we're learning about this virus. I do want to say that it's not fake news. This virus is non-discriminatory, and it doesn't matter whether you're Black, you're white, you're Latino, you're Filipino, you're young, you're old, you're healthy, or you're not healthy. This virus is affecting everyone, and it is lethal. It's effective in what it does. And I know that firsthand because I'm caring for COVID-19 patients in my intensive care unit. And I have had very little time off since this has started because I am taking care of people and I'm seeing people die. And I'm trying to help fight COVID-19. I won't talk about a lot about what I'm doing in the adult population. But I just wanted to briefly mention that initially when this came out, it was thought that children really aren't affected by this, and that the infectivity rate of children was extremely low, and that they were going to be fine. Now, as this disease has progressed, what we're finding is that there's more interest that's being shifted to how it is truly affecting children. And there was an article that just came out in Lancet, actually on May 13th of 2020, that stated that there was approximately 1.7% of cases, pediatric cases, in the United States. Now, when you hear 1.7%, that might be, a low percentage. But we're not sure whether or not that's a low percentage because kids are asymptomatic carriers or whether they have less susceptibility to developing the disease. We don't know what that means. What we do know is that there's this entity that's now being likened to that of Kawasaki's disease, which is a pediatric vasculitis, which means that it's an inflammatory process that affects the vessels in children. And they're calling it pediatric inflammatory multisystem syndrome, not Kawasaki disease. So you may, in the media, hear it being referred to PIMS, which is pediatric inflammatory multisystem syndrome. Things that you need to look for as healthcare providers, because right now you're taking care of these as children of essential workers, and so you too are a healthcare provider, are things such as children presenting with fever, abdominal pain. They may be complaining of feeling nauseous. They might have vomiting, diarrhea. They can come in with eyes that are red, conjunctivitis that look like they have pink eye. Their tongues may be swollen. They may be big and pink and red. They may have a rash on their palms or their soles of their feet, or they may have large lymph nodes in their neck. And so oftentimes, that's typically what you might see with any child that comes in with a virus. But right now, if you see that, you need to be concerned about a child potentially having been exposed to COVID-19. The good percentage of these patients, if they get really sick, progress to requiring hospitalization because this virus and this syndrome can affect the heart, and it affects the blood vessels to the heart and can cause aneurysms and can cause the kids to go into complete shock and end up on a ventilator and life support, and they can die. That's why it's so important that we take this virus seriously. And it's so important that if you are currently caring for children or you plan to reopen soon, that you have a policy in place as to your screening of children when they come. And not only just children, but their parents. Because remember, there's a great percentage of kids also that are asymptomatic carriers. And so they may be fine and they may not have the symptoms of what we traditionally think COVID-19 looks like. But then a few weeks after, we're seeing these kids have this inflammatory syndrome. And when they're coming into the hospitals and presenting to the offices, not all of them are having a positive swab for COVID-19, and their swab is actually coming back negative. What is coming back positive is that they're testing positive for antibodies, which means that they probably had it, they did fine with it, and then as a reaction of the virus, they are now having this inflammatory response. It's very similar to what we're seeing in adults as well, but the manifestations for children are much more serious, and in children as a whole, may be what is spreading COVID-19 in the sense that there's a larger percentage of asymptomatic carriers of children. And so they're going back to their homes, and their families are actually their mom, their dad, their grandparents, their aunts, their uncles are the ones that are getting sick.
Right. Thank you so much for all of that information. It's so vital and so important to all of us because we are in our homes. We're allowing the children in our homes, and this is where our families are, so we definitely have to be careful. I thank you so much for that. I love you for being who you are. I applaud you for being a first responder at the hospital. You are a wonderful mother, wife, and sister. I thank you, Ayana. Thank you. Thank you. I'm getting such good things here. Thank you, Dr. Ayana. Can you make a list of all the signs you mentioned? You're going to have to go on Google. I will see if I can come up with a list for you or something like that. Thank you so much. I have appreciated this Zoom. I pray that in the event that I do this again, it will be without error at all. And I must thank my daughter, Chanel, who is here with me. And I'm yelling at her and pointing at her and poking her, helping me with the chat box and all of that. So I thank all of you. You are essential. Practice some gratitude. I love that, LaShana. Gratitude. And enjoy the rest of your day. And remember, if you don't want to be a chronicle, don't do it. Have a great day, ladies.